All right. Greg, get out and give me 20.
Oh gosh, no.
20. You can't sit before you do that. No.
Whoa, please. Here we go. I'll give you a little difference up the outfit. All right, that's good. That's good.
We are in the health and fitness industry,
Right.
So I mean, doing dips and all those things, it helps.
That's fine. That's fine.
Yeah. So Greg, basically, Greg's a definitely the health expert over here, and he knows a lot about insurances and what transpires internally, which is pretty awesome, right?
Right.
So you could tell people why really where the world actually is going. It's going to health and wellness.
Right.
And we talked about Paul Zane Pilzer last. Talked about how our industry is going to be $1 trillion industry.
And he's right. Yeah. I completely sign.
But he's an economist,
right?
So here's a guy that knows what the hell he's talking about.
Because it's very clear. Luckily for me, being a physical therapist, because I own my business, I have the last 3 years I've really been in the insurance part of it more than the actual physical therapy part of it. And here's the deal. Basically, there's two aspects to this. Number one is there's private insurances. Blue Cross Blue Shield, Aetna, Cigna, United, Humana, TRICARE. Those are private insurances, okay? And then you have your government insurance. I should kind of say TRICARE is kind of a government, but really Medicare and Medicaid, okay? Medicare is for people 65 and over. We have used up all the money in our country. The reason why we're in so much debt, partially, is because of Medicare. It's because there's more people, and we have to pay out a certain amount to people that are 65 and over. So our government is always looking for ways, now that they've created so much debt, ways to get rid of it. The first time this happened is in 1997. Bill Clinton did this thing called the Balanced Budget Act. Basically got rid of nearly a quarter of the physical therapy field. Okay, it's just basically a way for them to say, okay, we're not going to spend as much money on healthcare, right, so that we can save that money and we can pay back Japan and pay back all these other countries. Okay, same thing is happening now. It's called Obamacare. It's called Affordable Care Act. Whatever you want to call it. Is it a good thing? Well, kinda. Is it a bad thing? Well, depends who you talk to. The way it works is that we are going to be capped to a certain amount.
Right.
If you have $500,000, $200,000, $300,000 in medical bills, well, it's not going to all be paid for. There's a capped amount that is going to be for nearly everybody. Whatever Medicare does, other insurances follow. Now, you have to understand, the reasoning for it is because they owe a lot of money. They have a lot of debt. We have a lot of debt in America. Private insurances, well, they don't have debt. They make a lot of money. But what they want is they want us to pay more in premiums, okay? And they want us to get less, because that's how they profit.
Yeah.
It's just the law of the land. So they're going to follow whatever Medicare does.
Yeah, it makes sense.
Yeah.
So how do you relate that to our industry and the health and wellness? Like, if you were to, how does someone look at that and go, okay, well...
So what's the opportunity for us, right? Okay, so the opportunity for us is this. 70 to 80% of our diseases that we have in the United States are preventable. And if you talk to any physician, you talk to anybody in the healthcare field that has any type of knowledge of this, they will tell you that the preventable measures that every person can take is by eating healthy, is by doing moderate exercise, and basically making that a lifestyle change. So the reality is this: there's many things out there that can allow you to lose weight. Remember, I didn't say lose weight per se, because being healthy,
right,
weight loss is a byproduct of that.
Lifestyle.
Okay, that's what happens when you start to live a healthy life, eating clean, exercising. Weight loss happens.
Okay.
Unfortunately, we are a vanity-driven society. So we want weight loss without doing the healthy measures. So
you mean the shortcut? A lot of people want to take a shortcut
right.
to get there.
Green tea, 5 days, 5 pounds. That's what we want. Okay, that's not everybody, but that's what a lot of people want. But now, once it starts to hit your pocket, you start to think a little bit different.
There you go. All right.
Okay, so it's not a matter of is healthcare going to or fitness and wellness going to be the way that we have to go. That is the way we're going to have to go. The question is how are we going to do it? And what I'm saying is that a company that has it set up to where they have fitness, they have nutrition, they have support, the accountability, and giving people just that little extra with rewards and prizes, that is the full solution.
Yeah.
Okay?
And the thing is that we're not the only company that does that.
Right.
Okay, I will say that, but we're the best company.
In my opinion, yes.
Yeah, I mean
It's not even close.
I'm not even. That's no
Right.
lie. It's no joke.
One of the biggest reasons why I decided, because I haven't been a coach for that long. I've only been a coach for 14,
So we're a coach
15 months.
we are coaches of Beachbody.
Of Team Beachbody. And the reason why I decided is because I saw that they were now hitting a demographic of the people that need it. P90X Insanity, those programs are phenomenal, but those
Yes.
programs are for higher level people. Just like
yes.
what you said, even though you only had 25, 30 pounds to lose, it was still really hard for you in the beginning, right?
Yep.
And you can tolerate them pretty good now, but most people can't do that because we're a much unhealthier society now. So they are now with 21-Day Fix, with P90, with PIO, with some of their newer programs, they are catering
Right.
to that demographic of people, and that's what got me interested in it, because I realized that we can now help people. We can help a huge conglomerate of people, and that's the reason why I personally believe this company is the right company to affiliate yourselves with.
Yeah, I mean,